Drug solutions. It is estimated that 6 to 8 million American children take psychiatric drugs for ADHD and other so-called learning and behavioral disorders. Approximately 1.5 million children and teenagers are now prescribed antidepressants. The potential side effects of these newer antidepressants include anxiety, agitation, insomnia, bizarre dreams, suicidal thoughts, hostility, and violent behavior. This comes from the Citizens Commission on Human Rights International, 2002. In 1999, the former U.S. Surgeon General David Satcher admitted the diagnosis of mental disorders is often believed to be more difficult than diagnosis of general medical disorders, since there is no definitive lesion, laboratory test, or abnormality in brain tissue that can identify the illness. Prescribing psychotropic drugs for a disease that doesn't exist, psychiatrist Dr. Sidney Walker noted, is a tragedy because masking children's symptoms merely allows their underlying disorders to continue and in many cases to become worse. So what the last two sides are saying is that there is no diagnosis for ADD or ADHD. It is a list of questions that are answered, and if you meet the criteria, then you get the diagnosis. But there is no objective test that can identify and diagnose these syndromes. So unsuspecting parents typically rely on the professionals trusting them for an accurate medical diagnosis, unaware that there are no medical diagnoses in psychiatry, only subjective criteria. If you answer the questionnaires and 8 out of the 10 you answer yes, then you have that diagnosis. But once again, there's no objective testing. So we talked to our kids about, don't take drugs and having your school as a drug-free zone, but yet here we are having our kids taking Ritalin. And Ritalin is a Schedule II drug, meaning an addictive drug with a high potential for abuse. Adverse reactions include loss of appetite, insomnia, headaches, stomach pain, weight loss, racing heart, seizures, and stunted growth in children when taken long term. Suicide is a major complication of withdrawal from Ritalin. Other Schedule II drugs are cocaine and morphine. This is how addictive Ritalin can be. And this is what we're giving our children to treat them for ADD and ADHD. Ritalin-free solutions for hyperactivity. 6 to 8 million school children, mostly boys, have been diagnosed with attention deficit hyperactivity disorder. Some of the symptoms include difficulty learning, mood swings, hyperactivity, poor memory and concentration, daydreaming, clumsiness, low self-esteem, aggressiveness, and limited social skills. Given the potential side effects of drugs, identifying the drug-free solutions is of utmost importance. I'm going to go back and take a look once again at some of the... Again, look and see what some of these side effects are again. And moving on. So here I've listed 20 different things that should be checked, 20 items that should be checked with your child. If you suspect they have ADD or ADHD, you should check these things first before you go and attempt to give them things like Ritalin. Because these are much easier things to be able to diagnose and much easier things to treat. Not saying we can't treat ADD and ADHD, but it makes it a lot easier if we can rule in and rule out some of these other things. So we look at thyroid disease, anemia. Anemia is a big thing because it decreases fuel to the brain. If the brain's not getting proper fuel supply, it can't operate properly. Hypoglycemia, another issue of fuel supply to the brain. Diabetes mellitus, fuel supply to the brain. Seizure disorder, activity or activation components of the brain not working right. Post-concussion syndrome, effects of other drugs, effects of certain foods. Food allergies can play a huge part in causing issues with the brain not work properly. Depression, manic depression, anxiety, mild psychosis, sleep apnea, once again fuel supply to the brain, other hormone problems, lead poisoning. We all heard about the whole debacle with the toys that were coming from China, and they're using paint that was tainted with lead, and their children were getting lead poisoning. Inhalation poisoning, carbon monoxide, fumes from air propellant things that as far as aerosol cans, that type of thing. Malnutrition, vitamin deficiencies, since our food supply is very devoid of good nutrient levels. A lot of times we see malnutrition. Once again, that's fuel supply, lack of fuel supply to the brain. Vision, hearing problems, visual, tactile, auditory integration. Those things or their learning disabilities. As the brain is developing, it needs to develop in the proper order for it to be able to assimilate information properly. If it learns things out of order, the child has a hard time in school because it takes a lot of brain power to be able to learn properly in school. And if those areas are flipped around, mismatched, they will not be able to learn very well. And it'll look like ADD or ADHD, but it actually needs more attention from like an occupational therapist to help retrain those areas. So what's suggested is a high complex carbohydrate, moderate protein, low simple carbohydrate, sugar-free diet may be very beneficial. This is according to William G. Crook, medical doctor. The poor performance of the inattentive, overactive child is often caused by improper food, fuel, which I've been mentioning, too much sugar and other junk food, and insufficient amounts of nutrients, including carbohydrates, essential fatty acids, vitamins, and minerals. Also, various foods and food additives have been shown to affect hyperkinetic behavior in selected children. Food allergies and other sensitivities play an important role in contributing to behavior and learning problems in children. Not all children, but some children are affected by specific types of additives, preservatives, colorings, flavorings that are put in foods. And if we don't check to see if that's the component that's the problem, it's like a dog chasing its tail. You never quite figure out what's going on until you get these irritants out of their system. DHA is an essential fatty acid. It serves as a primary structural fat for your brain, retina, and central nervous system. Infants receiving DHA could see better, and studies demonstrate that children who are breastfed have an IQ advantage over those fed formula that didn't have the DHA. Children without adequate DHA may be more likely to develop behavioral and learning problems such as ADHD. Low DHA is also a significant risk factor for developing dementia and Alzheimer's disease. So the kids just don't need DHA, or sorry, they don't need DHA, but the parents need DHA as well. To compare behavior, learning, and health problems in boys aged 6 to 12 with lower plasma phospholipid total omega-3 or total omega-6 fatty acid levels with those boys with higher levels of these fatty acids. So they're doing a study, they're checking to see the boys that are having learning problems and then boys that weren't having learning problems, what their levels of these essential fatty acids was. And that they found was that a greater number of behavioral problems, learning and health problems were associated with the kids or the boys that had the lower total omega-3 fatty acid concentrations. That comes from the Journal of Physiology. Sorry about that. Journal of Physiology Behavior back in 1996. This is an essential fatty acid metabolism in boys with attention deficit hyperactivity disorder study. They took 53 subjects with ADHD that had significantly lower concentrations of key fatty acids in the plasma, polar lipids, and red blood cell total lipids than did the 43 control subjects. So once again, the kids that had ADD and ADHD had lower levels of these key essential fatty acids. And this was in the American Journal of Clinical Nutrition, 1995. So some of the things we need to make sure we rule out as well is aluminum toxicity and lead toxicity. I mentioned lead toxicity before, but these things have a huge component of potentially having children have problems with ADD and ADHD. This is studies that were found in Pediatrics 1978. So for an overview, a high complex carbohydrate, moderate protein, low simple carbohydrate, sugar-free diet may be beneficial. Need to avoid foods and food additives that they potentially have been shown to have hyperkinetic reactions within children. The pollution of our air, soil, and water has resulted in the contamination of many foods. Animal products are especially apt to contain insecticides and other toxic substances. These toxic substances may place a further burden on a child's immune and nervous system. Essential fatty acid deficiency has been proposed as a cause of hyperkinesias. DHA has been shown beneficial in both children and adults with ADD and ADHD. Aluminum and lead toxicity may be associated with hyperactivity. A calcium deficiency may cause hyperkinetic behavior. Normalizing elevated serum copper levels may be beneficial. Reduced zinc levels may be associated with hyperactivity, so we need to increase zinc in their diets. Iron deficiency may cause irritability and attention deficit. Iron is needed for your red blood cells. Your red blood cells transports oxygen. Oxygen is the fuel that your body needs in order to make energy to do all the work that it does. Magnesium deficiency is characterized by fidgeting, anxious restlessness, psychomotor instability, and learning difficulties. Magnesium deficiencies is very prevalent in the United States. Reduced taurine levels have been associated with hyperkinetic children, and they've shown that giving your children vitamins and minerals has helped to decrease the ADD, ADHD symptoms. So basically, as an overview here, it's going to find out that fuel supply, food, nutrition has a huge influence on child's behavior issues, especially with ADD and ADHD. So instead of first going to the extreme treatments of medications and drugs, look towards doing some of the simple things like changing their diets and foods, getting exercise, going to see specialists that are neurology specialists, especially chiropractic neurologists, who will take a look at the brain to make sure that the brain is balanced from left to right, and so that we can see the areas of deficiency become healthier, so that then the effects of the ADD and ADHD symptoms can be treated and reversed.